Creative art therapies like music therapy and art therapy have treated PTSD since the 1970s, even before it was listed as a diagnosis. So in this video, we're going to talk about how they treat PTSD and how effective they are. Hi, my name is JD and I'm a statistician and music therapist here to offer statistically significant support. And if you don't mind hitting those like and subscribe buttons so that you can get the support as it comes out. Having PTSD means you're more likely to have coronary heart disease, dementia, and TBI, at least for civilians. But veterans with PTSD are more likely to have more disabilities, pain, depression, catastrophizing beliefs, and sleep disturbances compared to veterans without PTSD. They're also more likely to have lower functioning. Creative art therapies can help improve PTSD and are thought to be effective by reducing hyperarousal through a relaxing experience, by just being relaxing. Also, by using nonverbal mediums to express difficult memories and emotions that are not easily verbalized. By containing trauma within a creative project, and this is to provide a sense of control, empowerment, and accomplishment. By making exposure to trauma tolerable through symbolism. And this is reducing avoidance so that you can actually address the issue in an easy way, in an easier way. But it also treats by finding pleasure in creating, and this activates the reward system and reduces emotional numbness. And it also allows for processing emotions and behaviors to activate parts of the brain related to post-traumatic expression. So one creative arts therapy is music therapy, and music therapy can help improve PTSD symptoms through interventions like having a group improvisation and then verbally talking out your thoughts and feelings after the improvisation. And one study showed that in less than 10 weeks, they were showing improvement in doing the group improvisation. But other interventions like group drumming and music and progressive relaxation can also help patients who have PTSD improve their self-worth and isolation, their sleep quality, and their anxiety. And you can also listen to music and make it a distraction or use it as a grounding technique or to emotionally regulate, which can help with the intrusive thoughts. Now, group music making and group improvisation can also help reduce the avoidance of people and triggers, while also encouraging positive social engagement. But when it comes to negative cognition and mood, your negative thought processes, music can also alter your perspective, activate the reward centers of the brain, and reduce cortisol and stress. To put this in a perspective with a case study, we have Jake, who grew up in Colorado and earned a bachelor's degree, but from high school all through his bachelor's degree experience, he witnessed the death of many of his friends and family members. So he developed suicidal ideation and depression and started cutting himself. Doing that, he turned to music to help prevent him from cutting, and he's even gone on record saying, "If there is a song or a melody that meets me where I'm at emotionally, I could listen to it on repeat for hours and hours." In some ways, this can magnify the potentially harmful emotion, but for me, even if it intensifies my sadness, it feels more like a comforting dark corner where I can just channel and truly feel the emotion without having to resort to self-harm. He's also said, "Oftentimes, music would be the only thing that could keep me from cutting." So he was avoiding his feelings, but the music was the only thing that allowed him to express himself and to cry and release. At one point, he was actually ready to kill himself, but Elliott Smith's Miss Misery started playing at that moment. Now this song met him where he was, and despite feeding his depression at times, the music saved his life and preserved his mental health. Now it's important to remember that Jake's experience shows the power and benefits of music, but just listening to music is not music therapy. Now thankfully Jake was able to capitalize on the music's benefits, but he did so accidentally. But a trained music therapist would have helped guide Jake through the healing process and would have done that through the music and done it intentionally and purposefully. Art therapy is another type of creative arts therapy, and it also reduces PTSD symptoms, but it does so through very different means like drawing, in addition to collages and mask making, and it uses these techniques in both civilians and veterans. So to put all this in perspective with a case study, Chief Echo, which is a pseudonym, was a chief petty officer in the Navy and served for 23 years and experienced several traumatic events. Before he did art therapy, he did several weeks of a non-creative arts therapy. But within art therapy, he did 90-minute group sessions where for 4 weeks, he made a papier-mâché mask and decorated it with items that had personal meaning to him. Now, on the outside of the mask, he put a small dowel under the nose, which he associated with a childhood memory. He also put white glue all over the outside of the mask, and this let it dry, and this gave the appearance of peeling skin, which for him represented a shedding process. On the inside of the mask, he put a small cotton ball over blue paint to represent tranquility and peace, and he put it on the inside of the forehead of the mask, which to him meant that he had a goal that he was constantly trying to achieve. He put clay and collage materials together in the form of TNT barrels and located it at the bottom of the inside of the mask around the mouth, and for him that represented his emotional triggers. And in week 5 of the art therapy process, he verbally processed all of his work with his group members. But at the end of all of the treatment, he self-reported improvement in functioning and in coping, and even successfully returned to duty. Now, despite all this compelling evidence, there's still very little research on using music therapy to treat PTSD and its efficacy on treating PTSD. But this is also true for the creative art therapies in general, and as a music therapist, this bothers me a lot. But this isn't just true for the creative art therapies. This is true for the non-creative art therapies as well. And even the research on those is stating that, at least for children and adolescents, no intervention can be strongly recommended. The research isn't even strongly recommending EMDR because of low evidence in both children and adolescents, but also combat-related PTSD. And this is despite evidence for its effectiveness in both. So instead, the research is recommending trauma-focused cognitive behavioral therapy as a standard first treatment to try. But even if trauma-focused cognitive behavioral therapy should be the first strategy, music therapy and art therapy can still take that approach. We would just take the trauma-focused cognitive behavioral therapy and do it through the art and the music. But the last point I want to make with this video is that there is evidence suggesting that 30 to 40% of people drop out in treatment that is not creative arts therapies when compared to treatment that is creative art therapies. And this is suggesting that the creative art therapies can maintain engagement in treatment. And when you put all of this together, you find that the creative art therapies, like art and music therapy, can and do treat PTSD, and they do so in ways that the patients find tolerable and engaging. So if you found this video helpful, please hit the like button. And if you want more content like this, hit the subscribe button so that you can continue to get statistically significant support. Thank you.